Take a deep breath now. Good.
Every day, someone who has fallen through the cracks of our healthcare system finds refuge at Health Brigade. This is quality care. These are seasoned clinicians, meeting patients eye to eye, making sure they're doing all they can for someone who doesn't have the means to pay for it.
So when I think about us as part of the safety net, we're really the sub-safety net. I mean, people have fallen through the safety net and then we're still catching them down here. So if they don't qualify for Medicaid, they still have nowhere to go. If they're homeless or if they're depressed or if they're having issues where they can't continue to function, you gotta have somewhere to go, especially if you don't have any resources.
This mission of seeing value in every person took root 50 years ago in the heart of the Fan District, in the middle of yet another era of American turmoil.
This was the time of the Vietnam War. You had a lot of revolution stuff kind of going on. People were very much trying to find their freedoms and trying to find their way along, and I think it was a backlash on the establishment. Right around the same time when people from VCU actually started saying, let's get a clinic going. And it was really for students primarily early on. And the goal was to help get birth control, because that was illegal. And once the clinic opened, it started bringing in folks who didn't have access to health care.
Fan-Free Clinic emerged out of this movement, developing a strategy and a mission to care for the most vulnerable in society without judgment. The timing couldn't have been better for a population of gay men who were devastated by the AIDS epidemic. Their lives cut short and last days often lived alone, abandoned by those who once loved them.
And Fan-Free Clinic was tooling along, doing health care. But when this whole AIDS pandemic hit, they really stepped up and said, what are we going to do to help people? And it made sense for the LGBTQ community because they were not well accepted in the general community, and Fan-Free had always been accepting of them and had earned its place in our community as a safe place to seek care. So even though we weren't providing health care for HIV, that's when we really started growing the other parts of the organization that had to do with case management and mental health and health outreach services.
I'm going to get a sample of your blood in this pipette up to the black line. Finger.
Today, Edward, an HIV test counselor, gently helps test a patient for HIV, connecting the roots of the clinic's compassionate mission. This fits under an umbrella of services delivered to thousands of patients each year. Now known as Health Brigade, the agency encompasses the primary care medical clinic, a mental health and wellness program, and health outreach and advocacy.
Each of those services are well integrated, so if a patient comes here for medical care, they can also get mental health care.
So that makes it challenging for us as parents to put the structure and discipline in place.
They can also get public health services in terms of testing for HIV. They can get into support groups. It really is taking that holistic approach and then using an integrated model to make sure that we're treating all of their needs.
Good. Everything sounds good?
As Health Brigade celebrates 50 years, its significance is not lost to the most vulnerable among us.
I can't pay for his medical insurance because I have 2 kids and pay my own insurance, so it's pretty hard, and I'm glad that this clinic exists.
Honestly, it's what I live for on a day-to-day basis, because to see people able to restore hope, because that's what it's really about, to restore hope at times when so many people are in pain and feeling so vulnerable. When we talk about grace-filled moments, that is what sustains me day in and day out, is watching the magic of that work happen every day.